Oh, Jeff's going down there. I don't need to stand up for Jeff to go down the steps. Good Lord. He's down there. He's over there. He's doing his presentation.
Won't we do the?
Yeah.
We do the Pledge of Allegiance first.
I hope. Yeah. I know.
Shake it up a bit.
Meeting was starting, but I guess maybe.
Everyone's here. And everyone, now breathe in. Roger, downward dog. Go.
Welcome to the City Council meeting this evening for June 12th. Appreciate everyone being here. And if you plan it, please stand and join me for the Pledge of Allegiance. And then we'll have our invitation this evening brought by Pastor Flynn. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Eternal God and Heavenly Father, we bow with humble hearts, with lifted spirits, thanking you for your many blessings you bestowed upon us. We thank you for your Son, Jesus Christ, and his finished work on the cross. But tonight we ask that you bless this city council meeting. Every idea, every plan, every thought, we ask that you run the filter through Jesus Christ. We ask that you bless our mayor, the city council, and their assistants. Remember our police department, our fire department, our first responders. And when we've done at this meeting, be the mechanics of our vehicle, let us arrive safely and find everything that we left, just as you left it. Lord, teach us to love one another as you have loved us. And lead us not into temptation, but deliver us from evil. For thine is the kingdom and the power and the glory. And we all say amen.
Please have a seat. Our first item of business is a special presentation. If I could have the Bonner Springs Education Foundation representatives, President Nancy Lander and Dr. Abbott, come forward with a special student artist, Rachel Beck. I'll let you introduce this. What's going on?
Good evening. Thank you for this opportunity. For those of you who don't know, we have an annual breakfast, a recognition breakfast for our teachers and students, and also to thank the business community for support each and every May, if we don't have a pandemic. Now, 2 years we did not have the event for obvious reasons, but each and every year we have a theme, and the theme this year is the power of community. And we ask a member of our the BSHS art department to give us artwork that we can then use for our flyers, which commemorate the theme. And this year, Rachel was chosen and worked with Mr. Ramanishan and others in the department. And would you hold it up? And you can see her artwork, and this is the original. Rachel is a resident of Bonner Springs, and she is now going to present that to the mayor and to City Hall.
Yes, the inscription. The Power of Community from the Rise and Shine Breakfast, May 26, 2023, presented by the Bonner Springs Edwardsville Education Foundation.
Well, thank you all very much. I appreciate the Education Foundation and their dedication to our community, as well as Rachel, the hard work you put into that. I understand it's award-winning. Did it win in state? Like second?
That was a different one.
A different one?
Yeah.
Well, you're an award-winning artist.
I guess so, yeah.
At the state level?
District level.
District level,
Mhm.
you won an award?
Yep, second place.
Second place. So that's wonderful, and it was highly acclaimed by the art department in the Bonner Springs High School. So let's give her a big round of applause. And we'll find a place of honor to place this in Bonner Springs City Hall. Thank you very much. Thank you. Our next order of business is a presentation from the Health Department, correct? Yep. I don't have my order of events. You come forward. You have the program here.
Okay. Hi. Thank you for having me out here, Mayor and City Council folk. My name is Hannah Connor. I am an epidemiologist over at the Wyandotte County Health Department. And your City Hall is lovely. This is actually the first time I've been here, so thank you for having us. So today I'm here to present the results of our community health assessment that we did throughout 2022. We do it every 5 years. It's a snapshot of the health of Wyandotte County, and then we use it to transition to our CHIP program. So next slide. Thank you. So just really quickly, what I'm going to cover with everyone today is the overview of our CHA process, some of that methodology of our CHA, some of the health outcomes of Wyandotte County, the community health concerns and barriers that we found through our survey, and then my colleague Susan Kamen will come up here and talk about the 2024 to 2028 CHIP development. All right, so first of all, I kind of alluded to this earlier, but a CHA is a community health assessment, and it's a comprehensive assessment of the county that collects data from national databases such as the census, BRFIS, things like that, and also community members. So we went out and collected data from our community members, and we also got to work with our partners through the health department to get some of that information from our community members. So this helps us better understand what the community's health looks like, and it will guide the work of our health department for the next 5 years. And it's also part of our FAB accreditation, which is something that we were able to gain during the pandemic, so that was very exciting for us. Next slide, please. Thank you. So first, I will talk about our methods for the assessment. So we gathered primary data through community concern survey, which I'll go into for the most part of this presentation. We also did community forums, focus groups, and we collected that secondary data that gave us some information that were collected by, national databases and things like that. Thank you. This is our timeline. So this kind of illuminates everything that we did over the 15 months that we got to work on this. For our surveys, focus groups, community forums, analysis, and writing of it. Really all you need to note here was it was about a 15-month process. Thank you. All right. So I'm going to be talking a lot about our survey today, and so I want to cover some of the respondent demographics. We sent out the survey to 7,000 households. We worked with the ETC Institute, which is what the UG actually works to send their community survey through. We had 207 respondents from Bonner Springs and Edwardsville, and those results numbers will come up in red throughout the presentation. We did have 73 responses from Bonner Springs specifically, and that seems kind of a small number, but we did attain a representative sample, so that is supposed to be representative of the 7,600 residents of Bonner Springs, even though it does seem a little small. What being representative means is that we had an accurate representation of zip codes, age groups, income, education, race across Wyandotte County. The only sector that we didn't get an accurate representation of is households with children. We got about 21% of respondents with children, and the actual number is 31% across Wyandotte County. And this is probably just due to the inherent busyness of life with children. Next slide, please. Thank you. So what you see here is our top health concerns and top health barriers that we assessed via the community health assessment. Those were our first two questions. We gave folks a list of 10 items to select from, 10-ish, and the top 5 health concerns that came out were community violence, drug misuse, mental health, other chronic diseases, and poor nutrition or obesity. The top health barriers were healthcare access, employment and income, affordable housing, violence or crime, and health literacy. And one important thing to note here is that for all of Wyandotte County, healthcare access was the #1 barrier to being healthy, but for Bonner Springs and Edwardsville, that top health barrier was employment and income. Next slide, please. Thank you. So next, I just want to cover some of the health outcomes of Wyandotte County. Next slide, please. The county health rankings is through the Robert Wood Johnson Foundation, and they're able to rank all of the counties throughout Kansas. Unfortunately, Wyandotte County ends up towards the bottom of those rankings. Even if we do get healthier, the entire state is getting healthier, so sometimes that looks a little bit depressing, but things do sometimes go up as well, and it's just not always reflected here. But basically what we have here shown is that we are 103 out of 104 counties for health outcomes, and 104 out of 104 counties for health factors. Next slide, please. Additionally, in our CHA, you can find all of the top causes of death in Wyandotte County, and we've broken these out by race in this slide here. So the overall causes of death are very standard. That heart disease, cancer, COVID-19 being the top causes from 2018 to 2020, and then all other accidents and chronic lower respiratory diseases. Those are pretty standard nationally. But some of the interesting pieces here that we like to point out is that for the Black, non-Hispanic, and the Hispanic subsets is that homicide is in the top 5, which is something that concerns us and something we want to work towards. And also the Hispanic population was greatly impacted by COVID-19 as that was the #1 cause of death. Next slide, please. Thank you. This is also our Wyandotte County life expectancy. So life expectancy is calculated from your census tract when you were born. And so we have these broken out by race. You can see that the white life expectancy is 74.7, and the Black life expectancy is 71.3, and the highest life expectancy is 82, and the overall is 74.7. Next slide, please. We also want to note kind of that life expectancy gap throughout the county. We know that these are very drivable census tracts to each other, but towards the east we have a very low life expectancy of 62.5, and out west we have a really high life expectancy of 83.7. Bonner Springs falls right towards that higher end of the spectrum at 77.7 years. Thank you. So now I'm going to dive a bit more into those survey health concerns. So the #1 health concern for both Bonner Springs and Wyandotte overall, next slide please, is community violence. Thank you very much. So 62% of our Wyandotte County residents put that as their top health concern, and 63% of Bonner Springs and Edwardsville respondents put that as their top health concern, and 39% that violence is also a barrier to health. Next slide, please. Thank you. So 56% of our respondents across Wyandotte County said that they felt extremely safe or very safe in their neighborhoods during the day. And out here in Bonner Springs and Edwardsville, they said 73% felt safe or extremely safe. So that's a really good number, I think. And then at night, the numbers go down a little bit more, or to a little bit less, at 40 and 56% respectively. The second biggest health concern across the county, east and west alike, was substance misuse. We know that that has increased a lot over the past 5 years. That is a national trend that we are unfortunately not an exception to. And we did lose one of our only inpatient facilities last fall, so currently there are no inpatient facilities for substance use disorders in Wyandotte County. Fortunately, we do have a substance misuse coordinator now in our our community health division. And so hopefully we can get some work done on that. Next slide, please. The third biggest health concern is mental health, and a majority of our respondents reported either having somebody in their household or having themselves have a mental illness. And then we also saw on a separate question that COVID-19 had a major impact on mental health. Next slide, please. Thank you. There is a high demand for mental health in Wyandotte County. Some parts of Wyandotte County are a HRSA designated zone where there isn't enough mental health care for the need. That's kind of reflected across all of Kansas. It's one of the lower ranked need versus demand states in the United States. So that's something that we can focus on as a county, maybe improving over the next few years. This is not currently a part of our community health improvement plan, nor do we have a person in the health department who focuses on this. So it's really interesting that this came up as such a big issue. Next slide, please. All right, and then our last two health concerns were chronic disease and obesity, which we know both of these are very complicated subjects. They come from things like nutrition, built environment, can you exercise, do you have access to health care for some of that preventative health care, things like that. And what we see is that chronic diseases like heart disease, diabetes, and kidney disease are leading causes of death in Wyandotte County. All right, next slide, please. Next, I'm gonna go into that second question, which is health barriers. So just a few more slides about this, and then we'll move into some of those community assets and more about our community health improvement plan. So the number two in Bonner Springs and Edwardsville barrier to being healthy is healthcare access. And what do we mean by healthcare access? We mean that you are able to access healthcare and it's affordable, it's convenient, you're able to get an appointment when you need it, and you're able to easily get there. However, we saw that nearly a fifth of our respondents did have issues getting healthcare in the last year. A little bit less for Bonner Springs and Edwardsville than the rest of the county. But what we do know is that about 19% of Wyandotte County residents do not have health insurance. And that there's disparities in race there as well. So 16% of black residents are uninsured and 36% of Hispanic residents are uninsured, while 6% of white residents are uninsured. So there are some big disparities there. Like it says here, fortunately in Bonner Springs, there's a really good insurance rate. Only 5.1% of people are uninsured. Thank you. And those top reasons for delaying health that we asked about in our CHA is typically related to cost or not knowing if the condition is serious enough, not being able to get your appointment soon enough, and sometimes because they didn't have insurance that would cover the appointment. Thank you. Some of the top challenges in obtaining medications, because we know that can be an issue, was also cost of medication and the lack of coverage by insurance. Thank you. All right, the #1 health barrier in Bonner Springs and Edwardsville is jobs and education. Jobs and education can be a barrier to health because we all know that a good job that provides you health insurance, paid time off for being sick, paid time off for even going on vacation and spending time with your family, well-paying jobs that allow you to pay for programming for your children are very important to health, right? But what we see is that 43% of the entire county and 42% of Bonner Springs and Edwardsville said that they disagreed or strongly disagreed with the prompt that they believe that their community has enough jobs that pay enough money to live a healthy life. Fortunately, this is one of those things that have been in our community health improvement plan, and we've been working really hard on how we can kind of approach that work through a health lens and continue to hope to do so. Next slide, thank you. Also, 19% of respondents said that education was a top 3 barrier to health. We know that education leads to good jobs. A lot of the times, it's important to have good jobs that can exist without education, but a lot of times the latter precedes the former. And then we have 18% believe that the schools in their neighborhood give education to all students. That was disagreed or strongly disagreed. Thank you. Next slide. Perfect. And then the 4th biggest health barrier in Bonner Springs and Edwardsville, the top 3 overall, was affordable housing. By affordable housing, we mean that you're able to pay for your rent, your utilities, or it's your mortgage, or it's your gas, all of those things combined for less than 1/3 of your gross income. And what we know is that about 30% of Wyandotte County residents are considered cost burdens, so they're spending more than 1/3 on their income and living expenses, and that means expenses for things like food and health care and after-school programming are getting diverted to their living expenses. And what we also found was that nearly 50% of Wyandotte County respondents reported that they sometimes, often, or always feel worried or stressed about having enough money to pay for those monthly living expenses. It's slightly lower in Bonner Springs and Edwardsville at 44%. Thank you. And then lastly, this was not a top concern or barrier, but we did want to bring it up because we stratified a lot of our questions. We looked at them by race, by ages, by income, things like that. And one big difference we saw was the differences in the responses to our questions about racism when we stratified them by race. So overall, 19% of respondents said that racism was among their top 3 barriers to health. That wasn't a top 5. However, when we broke it out to black versus white versus Hispanic versus Asian, we saw that 27% of our black respondents have felt emotionally upset or angry as a result of how they were treated based on their race. Next slide, please. And a lot of ways in which that manifested was getting a job or being promoted or buying a house or car, which ties right back into some of those barriers that we talked about. And 40% of our black respondents said that racism usually or always impacted their life. So that was just something that we wanted to bring to people's attention because as you can see from the comparisons up there, there is a stark difference when we look across race. Thank you. All right, I think I talked enough. I will be back for questions, but I am going to bring up my colleague, Susan Kamen. She is she's been the CHIP supervisor for CHIP coordinator for several years, but she just got promoted to the CHIP supervisor, so that she will be presenting to you about our community health improvement plan. Thank you.
I'm gonna switch laptops here, if that's okay. Oh, no, it's plugged in. Put it on top. All right. All right, good evening, Mayor and City Council members. It's great to see you all tonight. Thank you so much for the invitation. And so, as Hannah mentioned, I'm Susan Kamen, and I'm the Community Health Improvement Plan, or CHIP for short, program supervisor. And today I'll be briefly speaking on community needs and assets, which is also a section in our community health assessment. And then I will be speaking about our community health improvement plan, which you should have that Navy booklet in front of you. That's right, thank you. That provides a nice overview of that work and how we utilize the community health assessment data to inform our CHIP planning. And so if you go to the next slide, so this table is showing the top 3 needs community members identified in our community health assessment concern survey, and it is showing the percent of Wyandotte County overall, and then also the percent of Bonner Springs, Edwardsville respondents. And the top community need for Wyandotte County overall is mental health services. And for Bonner Springs, Edwardsville area respondents, it is safe places to walk in or play. However, it is important to note that those two are very close. They are high need services in the county overall as well. And when we look at the bottom of the table, there are also some community needs there that were identified more frequently by the Bonner Springs Edwardsville respondents than in the county overall. So when we look at that bottom, we see after school programs, additional health services, specialized health care were selected by more than 20% of respondents in Bonner and Edwardsville, but less than 10% in the county overall. So that is an important note there in difference in terms of county overall versus Bonner Edwardsville folks. And then another section in our community health assessment really looked at community assets. So it's important to take a look at, health needs, perceptions, but we also have to do an inventory and a review of assets that we have in our community as a whole. So we did compile a list, in the full report you will find that, of different coalitions, nonprofits, community programs, community resources, many of which are included in our community health improvement plan, but many of which are independent and do great things and devote time, resources, and expertise to improving our community here in Wyandotte County. And I invite you to visit that list in our full report. And we're always are looking to add to that repertoire of resources and information in our community. So if you go to the next slide, then I will speak on how we, as a health department and as a community, will go from a community health assessment, which is a full process, as you heard from Hannah, collecting a lot of important information from our community and lead into our community health improvement plan. So this is what we like to call our CHIP cycle, so Community Health Assessment, Community Health Improvement Plan cycle. And so you'll see at the top of the diagram, we have completed that assessment and understanding of the data through the community health assessment process. And now we're getting ready to step into that next step, which is to prioritize and plan, which is the work of our community health improvement plan. That we will then implement alongside community partners in Wyandotte County overall that have a stake in the areas and the health issues that we hear from community. And this is a cyclical process intentionally because we should often be monitoring and evaluating because the issues and the health concerns that you heard about today are complex issues. They will not likely go away in a year or two. They will take intentional effort, intentional time, resources, expertise, and collaboration across sectors for us to see health improvement. And so we need to be, revisiting constantly, and that's why this CHIP cycle is intentionally in this way. And we do this process every 5 years. So the next slide shows a bit of a timeline, a high-level timeline. Right now, we're in spring, early summer, late spring, and so we are working to present the community health assessment data and findings to the community and stakeholders to increase that awareness and education around the health findings and issues identified by the community. And then we'll set priority areas. We can't feasibly address all of the health issues that you heard about tonight. And so we need to prioritize as a community and narrow that list in what we'd like to focus our efforts on our community health improvement plan. And then we'll, as a health department, lead a series of goal and strategy development sessions. So in your Navy book, if you go through that booklet, you'll see each of the priority areas we're focusing on right now, and you'll see specific goals and strategies and objectives that we've worked on together for the past 5 years of our current CHIP. And so we'll do something really similar for the new priority areas in this next one, with the hopes of launching that new community health improvement plan for 2024 to 2028 at the end of the year, early next year. And so the next slide, as I mentioned, this process is not new to our community. We have done a 2018 to 2023 community health improvement plan and are working on continuing those efforts. We've got 4 priority areas. All of these 4 should sound familiar. You've heard about them tonight as well. Jobs and education, healthcare access, safe and affordable housing, and violence prevention. And at the health department, we do partner with what we call lead agencies, which are organizations in the community that help coordinate and convene additional stakeholders and organizations in each of these areas to implement projects and strategies through the work of the CHIP. So for example, in our jobs and education priority area, our lead agency is the Wyandotte Economic Development Council, and we work very closely with them at the health department in convening different subcommittees and strategies for the work of the CHIP. And then we do have currently our what we call CHIP lenses, which is the recognition that poverty, racism, and adverse childhood experiences are cross-cutting and are factors that influence each of the 4 priority areas. So the next slide, we've done a lot of work together as a community over the past 5 years of our current community health improvement plan, and these are just a few highlights. I do invite you to take a look at that booklet. We also have a CHIP page on the back of that booklet. There's a QR code where you can find more additional information about that, or just reach out to us at the health department and we'll be happy to sit down. But these are just a few highlights, one of which is we were able to launch a non-emergency medical transportation program, which is a partnership between the health department, UD Department of Transportation, and all of the safety net clinics in Wyandotte County. And it provides fare-free rides to any patient or any community member in Wyandotte County that has an appointment at one of the safety net clinics in Wyandotte County, which is 9 of them. It's clinics like Vibrant Health, Swope, Family Healthcare, Mercy and Truth, Duchesne. Those are just a few of the examples. We also, and that's through our healthcare access, and that's a photo of the vehicle, the microtransit route van that provides that service. We also were able to partner with the Wyandotte Economic Development Council and USD 204 and all of the other school districts in Wyandotte to host bus tours for local high school students to showcase careers and businesses here in Wyandotte County. So specifically in Bonner, we worked with the graphic design track folks out of USD 204, and I know that they got to visit a couple of local businesses and kind of hear about those careers and go through the KCKCC's FAME Lab and tour that. I know those bus tours were really fruitful, and there's an image of that right there on this slide. And then lastly, we've been also able to do a series of tenants' rights and responsibilities trainings for individuals that work with renters and tenants in our community to let them know what their rights are, what to do when those are being violated, and also what their responsibilities are, how to maintain their space, how to keep up with basic maintenance, if they have visitors, how to handle that, and how to communicate with their landlord. And those have been really successful. We got great feedback last year from those series of sessions and trainings, and we're hoping to expand those this year and continue them. And so, like I said, those are just a few examples for the sake of time, but just wanted to take a moment to highlight those. And then next slide. So here are the top health issues you heard about today, identified in our new community health assessment. And there are a lot of things on this list in order to improve the health of our community. And everything on this list is very important. However, if we try to prioritize everything on here, we we'll end up prioritizing nothing. And so we do need to go through a prioritization process in which we invite stakeholders, all of you, to provide feedback and weigh in terms of what should be our priority areas of focus that will be addressed through the next 5 years of our community health improvement plan. And so we are beginning the process to do that. This is just the beginning. And so we are asking for feedback in the next slide through a survey to collect input on the health issues identified in the 2022 Community Health Assessment against important criteria. Level of community concern, which is just the extent to how much people care about the issue and how willing they are to resolve it. Feasibility, which looks at a number of different factors, such as, are there strategies to address that issue? Is there political will? Are there resources in our community? Are there partners ready to sort of take ownership of some of those strategies and move action? And then impact on health equity, and that looks at the health issue in and of itself and asks you to consider in terms of that health issue. Does it create disparities? Does it affect certain populations based on race, ethnicity, geographic location differently in Wyandotte County? And are we improving health equity overall by addressing that issue? And so that survey is just intended to be the start to collect information, and we will take that internally at the health department and present it to our CHIP steering committee. And they'll help us sort of weigh that data and information against some of the health assessment information from community members. So this is just our way to collect feedback from the stakeholders in the community, having heard from community members through the health assessment process. And then that QR code will take you to that survey. And just want to thank you all again for your time tonight. We definitely appreciate it. There's our contact information for Hannah and myself and our Deputy Director, Terry Garrison. And then if you go to the next slide, you will find just additional resources. Our full community health assessment report can be found on our website. We also have some printed copies. We wanted to bring them to you tonight. They're nice booklets, but they're in the printer. They weren't quite ready, but we can certainly get those to you when we receive them. And then the other side of the screen there is information on our community health improvement plan, all of the reports and booklets since we've had our current CHIP, and then also that link to the health issue prioritization survey I spoke about. And that concludes our presentation. Thank you again for your time. That is a great question. In my opinion, I am a little, I've worked with our community health improvement plan, our current one, since I've been in this role. And so I do recognize, all the work that it's taken to create partnerships, bring in grants and resources to our community. And so I see the value in continuing work in those 4 areas, so housing, jobs and education, healthcare access, and violence prevention, because it just feels like 5 years wasn't quite enough. We need to, we're ready, we learned a lot, we brought in resources, we tested strategies, and it feels like those 4 areas we'll continue to grow and we'll continue to move forward in those. And so I would pick those 4, but I am a little biased having worked on the community health improvement plan and our partners in that work for the past 4 years.
You said that there are no longer any substance abuse treatment facilities in Wyandotte County. I also saw that homelessness and access to affordable housing is an issue. Do we have any homeless shelters in Wyandotte County currently either?
Yeah, so unfortunately, there are no year-round shelters for the unhoused. We have a emergency cold weather shelter that comes into play in the winter months, but year-round we don't have that. We also find ourselves to be short on other types of beds, like for victims of domestic violence. So always searching for ways that we can improve that capacity. We know it was, we were hit kind of hard emotionally when we found out that Mears was closing due to reallocation of state funding. So yeah, we're definitely lacking beds and some resources for that kind of stuff. So making those connections, we know there are a lot of partners who care about this work a lot. So being able to make those connections and, you know, help with, we hope that anybody can use our CHA to apply for grants or any part of their planning. That data is definitely up for grabs for anybody to use for that sort of work. But yes, yeah, no shelter year round, unfortunately.
Thank you very much. And I also had a question. The non-emergency medical transportation, that's a great addition to be able to link people to access to care. But does it only go to healthcare facilities in Wyandotte County where we sort of have a healthcare desert, if you will? There's not a lot of healthcare facilities. Will it also take people maybe across the lines over to where other doctors' offices are, hospital systems, et cetera, like on the KU side or in Johnson County anywhere?
Yeah, that's a great question. We are really excited about our non-emergency medical transportation program. It is a pilot, and so currently it does only serve Wyandotte County safety net clinics. However, we are in conversations to expand that service and go into phase 2, in which we would be able to open it up to behavioral health appointments and also dental appointments, but we're not quite there yet. There's a few logistical things. I've learned a lot myself in terms of transportation and what it takes on the back end to coordinate all of that and have it be, you know, seamless for patients and community members. And so we're working on phase 1, and we've streamlined that for safety net clinics. Then phase 2 will still be Wyandotte County, but behavioral and dental. And we would love to work with Johnson to explore what a partnership could look like. There are some limitations because the primary service provider of the transportation is UG Transit. We would need to work with Johnson County Department of Transportation to then transition those individuals, unfortunately. But there are benefits to working internally. I mean, you know, Transit has those vehicles, it's their fleet, it uses their dispatchers, so we've been able to leverage those resources that are internally, but it doesn't present those limitations to where if a patient wants to travel outside of county lines, we have to kind of, you know, route that a little bit differently, and we're still logistically on the back end working through that process, but we want to get there.
Thank you so much.
Mm-hmm.
Is it possible to target if crime is high, mental health? Is there a component? Can you target one thing to why we're having these issues, or what's missing, or what could be put in place to kind of curve those numbers around from your professional standpoint? Racism, what?
So that's kind of what
Not to put you on the spot.
Yeah, so that's kind of what we've been exploring at the health department, because we know that Wyandotte was hit really hard by redlining. A lot of the census tracts were, you know, selected to be not invested in heavily back in the 1950s and 60s. And the results of that are still present today when we see, property values and things like that, and that was based in structural racism. So that's something we're trying to explore more, because we see that things like crime and houselessness do then correspond more heavily in those areas, and even things like environmental justice impacts those areas, so like less tree canopy, hotter areas, things like that. So that's something that we're exploring, and why we look through all of our work through a health equity lens. How are we helping those who are most impacted by it, and how are we looking at the structural factors that impact those disparities? So it's like, how do we level the playing field after these decisions were made, you know, almost a century ago, that made these disparities that we see today? So that's what we're struggling to work on for sure, and we're just like constantly asking ourselves how we can look at things through a health equity lens to kind of bring everybody up to the same level. For sure. It's a tough question, because it is hard to see when, you know, crime is targeted or concentrated in such particular places, and same with, you know, overdose and houselessness and things like that.
thank you very much for an excellent presentation and your questions. Excellent.
Thank you. Back on the non-emergency medical transport, do you have any numbers that can tell, is Bonner Springs utilizing that service?
We have had residents I have taken that have used the service from Bonner, Edwardsville area. And I know that was a big push of why we launched that service, just because understanding that Bonner, Edwardsville is not served by the public transit system. And I don't have those numbers off the top of my head. I don't want to provide you with the wrong number, but I can follow up with you, council member, and let you know what those numbers are of specifically Bonner Springs, Edwardsville
There definitely
folks.
has been some utilization.
Yes, yes, there has.
That's a good starting point. Thank you.
Mm-hmm.
Thank you for the report. As far as our county health rankings, the least healthy, have we always been last, or is it towards the very bottom? Is that just a historical thing that we've never been at 50 and?
Yeah, Wyandotte County consistently ranks on the lower end, if not the lowest, in terms of health outcomes and health factors.
Is it close, or is there something that skews us so far?
Yeah, that is a good question. And in terms of so the county health rankings, they do look at different health factors and health outcomes, and they do have a breakdown of the largest drivers. So the largest drivers in both categories that kind of have our numbers that make our ranking lower. And I think for Wyandotte County, that's years of potential life lost. Is that right? Yeah. So that's essentially.
Years of potential life lost.
So I'll let our EPI answer the years of potential life lost.
Yeah, so we go into this a little bit more in our full report, the year's potential life loss, but essentially what that is, it's a calculation. So you take the year 75, because that's kind of average life expectancy, and then if somebody dies at 43, then you take the difference of that. So that 32 years as the year's potential life lost. And they'll do that cumulative across the entire county. So it'll add up to, 2,000, 4,000 some years potential life lost. And they do that because it's not only a person's life lost, but it's also years of productivity, it's years helping to raise a family, things like that add value to a county. So that's one of the biggest players in that county health ranking calculation. And a lot of those disparities in health that we see. So we see a lot of deaths and hospitalization due to things like diabetes and kidney disease that are often very treatable, but we see those in a very disproportionate way where our Black residents are much more impacted by those sorts of deaths and hospitalizations. So things like healthcare access, so the preventative care, like things like diabetes and kidney disease are often very well treated from preventative care. If we have that healthcare access barrier, then we're not getting those preventative treatments, and folks are dying of younger ages from things that would have been treatable. So that also contributes to years of potential life lost. Some other metrics in the outcomes are like infant mortality, which for Wyandotte is higher than the state. That's also something that's different across race. So the Black infant mortality rate is 2.4 times that of the white infant mortality rate. So that can be calculated into the county health rankings. Also local low birth weight, health behaviors like drinking, cigarette use, things like that are calculated into that. And we do have high rates of smoking. However, that's something that has gone down since last time. But since cigarette smoking is going down across the entire state, that doesn't necessarily bump us up because everybody's doing better in that factor. So it's not to say that we haven't done better over the past few years, but everybody else is doing better as well. So it is unfortunate to see that some of those health disparities due to some of those barriers to health that we discussed really do keep us at the bottom. That was a very long-winded answer, but I appreciate you asking.
It's a complicated question. I just was curious on how much they break down the data that you get. It's broken down by years of life lost, the reasons why as well, or is that even data available?
Yeah, I mean, it is. It's a really interesting site. I think we have it linked in there, but we can also include it in a follow-up email to the board. But they'll break down all of the different rates for all of those health outcomes and barriers. So you can explore those a little bit more in depth. They get to be really interesting when you look at them.
Thank you.
Thank you.
I appreciate all the data that was there, and I appreciate the fact that you broke out Bonner Springs, Edwardsville separate. Even though we've found opportunities in the past to collaborate with our neighbors, we still operate under two separate governing bodies.
Mm-hmm.
Is it possible to get that data broken out? And I'm sure our Edwardsville neighbors would love it as well. So we know what specific, where Bonner Springs falls in some of those categories and Edwardsville falls in those categories.
Mm-hmm.
Because if we have to make decisions here and try to prioritize things that we might as a governing body do, it's important to know exactly those items that will affect our community and have the best potential outcomes.
Mm-hmm. Yeah, so we made sure to ask for everybody's zip code on the community health assessment. And so that's what I combined here was 66111 and 66012. So I can get that for just 66012 for y'all if you would like. Absolutely.
That'd be much appreciated. Thank you.
Mm-hmm. Mm-hmm.
I have no questions.
Mm-hmm. Thank you so much, everybody, for your time. We really
Thank
appreciate
you.
it.
Appreciate it.
I think he said he had a question.
Oh, you do have a question.
Right. Did you have a question?
Nope.
No?
No.
Okay.
No.
I think that's
No
everything.
question. Okay.
Great, thank you.
Thank you so much.
Very nice. Appreciate it. Moving on, the next item is citizens' concerns about items not on tonight's agenda. Those of you here that would like to address the City Council about items not on tonight's agenda have an open opportunity to do that. Please come to the mic and state your name and address. Those items that will be brought forward will be researched by the City Council and put on a future agenda if necessary. Please.
I won't be before you long. I'm Melva Jarrett with the Jerry Lee Jarrett Life Center. What I'm here for is to thank the City Council, but first the City Manager sitting back there. I want to thank you. And I want to thank your group. I couldn't think of what to call them, but what are they? Yes. Well, I want to thank you for bringing Mark. He doesn't even realize what he did, but he brought change to his community back in 2021. And his board set in and continued to change, but he brought the change and the variance that he had given us. And so I'm here to thank you, and also to invite each and every one of you, June the 24th at 1 o'clock, come and see your community. Come see what has happened in your community because of people like you all. A man used to tell me, please, leave it better than you found it, whatever it is. And we, all of y'all, Mark, my friend sitting over there, we've been born for such a time as this. Here's y'all's invitation.
Thank you. Thank you very much. Congratulations. Others said that, yes. Very good. Others that would like to stand and address the City Council about items not on tonight's agenda? Seeing none, we will move on to our first item of business, which is approving the consent agenda. The consent agenda this evening includes the minutes from the May 22nd, 2023 City Council meeting, claims for city operations, public use request for Bonner Blast, Tiblo Trot, and a block party for the Bales properties. Seeing anything to be pulled or changed by the staff? No? Anything, questions, concerns, anything to be pulled by the citizens? Seeing none, questions from the council? I'd entertain a motion.
Mr. Mayor, I make a motion to approve the consent agenda as presented.
Second.
So moved by Mr. Reeves and seconded by Mr. Shannon. Vote, please.
Stevens?
Yes.
Gurley?
Yes.
McMahon?
Yes.
Long?
Yes.
Shannon?
Yes.
Reeves?
Yes.
Wood?
Yes.
Kip?
Yes.
Motion passes.
Very good. On to our first item of old business, lift station number 2, design build phase 2 agreement. Staff?
Good evening. Frank Abart, Public Works Director. This bit of old business, we would like to request as a department to have this just withdrawn from the agenda. Is that possible?
Because we tabled it previously, we actually have to vote on it.
Okay.
So the motion is voting to decline it, and then the next item, the first item under new business will be the new
Okay.
revised agreement.
Very good. At the request of the staff, we'll entertain a motion to decline the lift station number 2 design build phase 2 agreement that we previously tabled. Any other input from city staff? Questions, concerns from the citizens? Seeing none, I'd entertain a motion.
Mr. Mayor, I'll make a motion to decline the design build phase 2 agreement with Burns and McDonald CAS Contractors LLC for construction of lift station number 2 in the amount of $3,860,031.
Second.
So moved by Mr. Shannon, seconded by Mr. Stevens. Questions, concerns, comments? We'll start here, sir. Ma'am. Sir.
None here.
Vote, please.
We're voting to decline the agreement. Shannon?
Yes.
Reeves?
Yes.
Long?
Yes.
Stevens?
Yes.
McMahon?
Yes.
Kip?
Yes.
Wood?
Yes.
Gurley?
Yes.
Motion passes.
Very good. On to our next item, the first of which concerns the lift station number 2 revised agreement. Staff.
Good evening. Frank Abart, Public Works Director. This is a revised agreement, which is pretty much the same as the agreement we just withdrew, except that it has restrictions on what it is we're going to pursue and a not to exceed clause in the amount of $650,000. What, in essence, this allows us to do is to proceed with the design part of the project, because as you know, it's only at about 30 to 35% at this point. This allows us to continue that design, complete it, and get it in the hands of KDHE for their review and comment and all of that, so that it doesn't delay that part of it. It also allows us to make the starting draft plans and shop drawings and things like that related to certain acquisitions that have a very long lead time, as in a year or more for some of these electronic components and things of that nature. And so it lets us continue working on those and get started on those until such time as we figure out the insurance component of this project, and then we'll be back in front of you when that all gets finalized.
Very good. Any other staff comments, questions, concerns? Seeing none. Citizens, questions, concerns? Seeing none, I'd entertain a motion.
Mr. Mayor, I'll make a motion to approve the revised Phase 2 design build agreement with Burns & McDonald and CIS Constructors LLC for construction of lift station number 2 for an amount not to exceed $650,000.
Second.
So moved by Mrs. Gurley and seconded by Mrs. Long. Questions, concerns, comments? And we'll start right here, ma'am.
No, it was very well described what it has to be. And when I think of the levels of okaying that have to work for, I forgot. The detail that you have to deal with, I appreciate your work.
Thank you.
Sure.
Just asking, as a curiosity, our temporary fix is holding in.
It was when I left the office tonight.
We don't talk about it.
Because that would. That's it.
Sir?
No other questions, sir.
Sir?
No questions.
Yeah. Very good. No other questions, concerns, comments. Vote, please.
Kip?
Yes.
McMahon?
Yes.
Wood?
Yes.
Gurley?
Yes.
Stevens?
Yes.
Reeves?
Yes.
Shannon?
Yes.
Long?
Yes.
Motion passes.
Very good. On to item number 2, water treatment facility project and owner's rep supplemental agreement. Staff.
Good evening, Frank A. Bart, Public Works Director. This is actually a supplemental agreement to a current agreement that we have for an owner's representative. As you may recall, we have a design build project with our water treatment facility as well, and it's actually starting to come up out of the ground because it's under construction at this point. So we, out of our initial funding that was, gosh, over a year ago, looks like this was originally October of 2020. So we were operating during our phase 1 and everything using those funds that were allocated at that time. Now we need to finish it out, and I wanted to request an allocation. Probably it's going to be about $450,000 before it's all done. I think it'll be less than that, but all of those funds will come from the SRF fund, which is what we already have allocated. So this is really not anything new. It's just that the agreement ran out, so I needed to do a supplemental agreement to extend this.
On money you already had authority for.
Exactly. It's essentially it's a requirement. They keep us in compliance with all of the state and federal requirements. They keep up with all of the documentation, and there's a pile of it. And do all the testing of the materials and the documentations of those tests for KDHE and the other folks that are going to review the project, both intermittently and at the end. So these are the folks we really depend on to make sure we're in compliance with those loan requirements.
Yep. Other staff input, concerns, questions? Citizens, questions, concerns? Seeing none, I'd entertain a motion.
Mr. Mayor, I make a motion to approve a supplemental agreement number 1 with BG Consultants Incorporated for continued owner's representative services associated with the water treatment facility project.
I'll second.
Moved by Mr. Stevens and seconded by Mrs. Gurley. No rush on any of that this evening. Questions, concerns, comments, and I'll start down here with Mr. Shannon. Ma'am? Sir.
I'm just impressed at how many different colors of clay there are.
All the testing, yep.
Yeah.
Nothing here. None here.
Very good. No other questions, concerns, comments. Vote, please.
Shannon?
Yes.
Long?
Yes.
McMahon?
Yes.
Wood?
Yes.
Gurley?
Yes.
Hip?
Abstain.
Stevens?
Yes.
Reeves?
Yes.
Motion passes.
Very good.
Thank you.
Yes, thank you. Best of luck. And anytime they want to come and let us know how things are going, they're more than welcome.
Okay.
Thank you. The owners.
I can take the hint, yeah.
No, I appreciate your input. No, but they're always welcome to come and say, we found an extra layer of clay. So,
Yeah. And it was a pretty red.
Yep. Thank you very much. Next item, the disposition of city-owned vehicle. Sir?
Good evening, Captain Mike Grouse of the Bonner Springs Police Department. Hopefully you all have a great evening. I come to you today to ask for permission or for approval to dispose of our old animal control van. It's the old blue one that was before the nice new black and white one that Kendra has now. It's been sitting down at the animal control facility. We've been using it for a storage facility / transportation of building materials as we've been developing that facility. I had the Bernese Auction Rescue Coalition, BARC, which is a dog rescue, an national dog rescue group. One of their members is a local resident in Edwardsville or works for the city of Edwardsville. Noticed the van just sits there and asked if we would be interested in potentially doing a direct sale to them instead of going through Purple Wave, being their nonprofit organization. And it used to be an animal control van with rear air and a bunch of stuff that would be beneficial to them and their organization in transporting these large Bernese dogs from the locations where they rescue them from to wherever they're going to be housed. So with that, we took their request, and we reached out to numerous other nonprofit organizations within the city of Bonner Springs, because there's quite a few here, and said, hey, look, we're looking at disposing of this vehicle by direct sale to a local or nonprofit organizations. Anybody with interest, submit a proposal for how much you'd be willing to pay for it, and we would negotiate that out past there. Unfortunately, none of the local nonprofits were interested in purchasing a vehicle. They just either didn't have a need for it or didn't have the funding or whatever the reasons may be. So Bernie's auction was the only one that submitted a bid to us in the amount of $7,500. Generally, we would put a vehicle on Purple Wave, and you can get decent money for it on Purple Wave. You can get absolutely no money whatsoever, or you could get the fair market value of it. Roughly, I think it's like $9,000 some on Kelley Blue Book. It's low mileage, older vehicle, in fairly good shape for its condition. However, again, on Purple Wave, it's iffy on what you're actually going to get out of it because it is a government vehicle sale auction. So they offered $7,500, and that's what I'm asking for approval to dispose of the vehicle directly to them instead of placing the vehicle on auction. I think $7,500 is a fair value for the vehicle and price. Given it going to auction would likely be that or less. In my 15 years of selling vehicles on government auction, that is what I propose as being a fair value. So that's what I'm asking for approval to do so, and it's going to a good organization on top of that. So.
Good. Thank you for coming. Any other staff input? Citizens, questions, concerns? Seeing none, I'd entertain a motion.
Mr. Mayor, I'll make a motion to approve the sale of the 2009 Ford E350 van to Bernice Auction Rescue Coalition for the amount of $7,500.
Second.
So moved by Mr. Shannon and seconded by Mrs. Woods. Questions, concerns, comments, and we'll start down here with Mr. Reeves.
Yeah, the only thing I would ask is we are doing this in the correct fashion so that we're not getting in trouble with other people that might have wanted to bid and so forth. Like,
no, I made a lot of phone calls to local nonprofits and made it known that we were attempting to dispose of the vehicle in this fashion. So,
fine with me. I think it's a good idea.
Additional question here.
I'm assuming from the way you described it that you cannot set a minimum bid on Purple Wave.
No, not with most of our vehicles because they're sold as is condition. Sometimes Purple Waves, people sometimes do set minimum bids and stuff like that. But even in a minimum bid situation, it would have been a lot less than this on the disposition of it.
Thank you.
Thanks for all your work, Mike.
Thank you, sir.
Good. No other questions, concerns, comments? Vote, please.
Reeves?
Yes.
Stevens?
Yes.
Kip?
Yes.
Gurley?
Yes.
Wood?
Yes.
McMahon?
Yes.
Long?
Yes.
Shannon?
Yes.
Motion passes.
Thank you.
Good. Thank you. On to the next item, purchase of a replacement code enforcement vehicle. Staff?
Well, if you guys hadn't have voted to approve that, maybe we would have did a little switch.
I was going to say.
No, just kidding here. We're here this evening to ask for, City Council to give approval to the city manager to purchase a new vehicle for the code enforcement officer. The one he's currently driving is on its last leg, if not on its knees. But it's run through its course. It's got over 100,000 miles on it. 116,000. Was a police cruiser prior to Mr. Stites obtaining it, and we know how those all are taken very well care of. Not saying anything, but anyways. Mr. Stites has run it through its course of life, and we are looking to get a new one. We did have some funds budgeted prior to COVID, but with COVID and supply chain issues and just cost increases in general, the money that we had in the CIP fund at $28,000 is not enough at all. I actually provided you guys with some information for one vehicle that we found that was under $40,000. We haven't found too many just little Ford Rangers anymore that are less than that. The one we found, Mr. Stites actually did a lot of research in trying to locate vehicles. We had one in Lincoln, Nebraska that was reasonably priced, but we were trying to figure out how to get it. He found one in Pittsburgh, Kansas that they actually said they would deliver it for a very nominal fee. So that is probably the route we're going, but that is what we're here tonight, is to ask council to at least up our funds. We did set it at $43,000 with the purchase price. We're also looking at having the lights. He has like, I don't want to say hazard lights, but flashing lights, indicators and stuff for his vehicle. When he pulls over, we're going to have those switched out. We had a local mechanic here said he could do that, no problem. So that money would also be included in that fee.
Very good. Other staff input, concerns? No other staff? Citizens, questions, concerns? Seeing none, I'd entertain a motion.
Mr. Mayor, I'll make a motion to approve the city manager to purchase a replacement codes enforcement vehicle for an amount not to exceed $43,000.
Second.
So moved by Mrs. Gurley and seconded by Mr. Shannon, and we'll start down here with questions, concerns, comments.
Oh, I can't. I was going to just give you a hard time. You know, you're going to have it, balance and all that stuff. I'm glad because
it's definitely well needed for sure. So
yeah, was that when I saw you pushing it down the street the other day?
Yeah.
Yeah. Okay.
Sir?
No question.
This was the car that I saw you in the road. You couldn't roll down the window to talk to me.
Yes, that
yes, due to some kind of electrical problem. And when you get rid of this one, am I correct? The plan is to just put them up on blocks over here, just let it set.
I'm hoping we can make
in the front yard of the city hall. No.
I'm hoping we can make yard art out of it somewhere here.
No.
The planter.
You do have a plan for its disposition?
Not really at this time. It may be a good vehicle for the fire department to practice. with the amount of repairs that need to be done with it, I don't know that it would even be worth much.
It was tongue in jest, but it will be stored appropriately and taken care of as necessary.
We may even need to use it for a little bit longer, so yeah, we're going to hang on to it for a little bit for sure, just in case.
Ma'am?
No. It's a mad fundraiser with the sledgehammer and somebody hits per dollar area.
You know there's going to be a few people in town that will be unhappy that you have a vehicle you can get out to.
I'm afraid of that.
Just checking.
Well, I think it's a shame that you're going to change this. Now, how am I going to recognize him who's not driving this piece of whatever that's been around for a decade or more?
Personalized license plate.
Because I heard you really enjoyed driving it.
I don't know if enjoyed is the right word for this. It's a challenge for sure. I did take it to a mechanic, and they stopped at $7,000 worth of repairs on it to even get it functional. So
very good.
It's time.
Yep. Other questions, concerns, comments? Seeing none, vote please.
McMahon?
Yes.
Kip?
Yes.
Long?
Yes.
Reeves?
Yes.
Wood?
Yes.
Shannon?
Yes.
Stevens?
Yes.
Gurley?
Yes.
Motion passes.
Very good.
Thank you all very much.
Thank you.
Thank you very much.
Appreciate your persistence in dealing with the concerns that you've had too. So thank you very much.
How long do you have to wait
What?
for the vehicle?
How long do I have to look?
Wait. What's the time?
They have it on the lot now, so hopefully.
Oh, you got it? Okay, good.
Pretty quick.
He's waiting for a phone call tomorrow morning after this vote tonight, so I think we're going to be
throwing the hot foot on
really
it.
soon.
So.
10 hours.
Thank you.
Thank you. On to our reports this evening, the first report of which is our city manager's report this evening, given by our assistant city manager, Amber Hogan.
The only things that I have to add besides what was already in the report is I don't think our closure on Monday was in there, so we will be closed on Monday for the city offices will be closed for the Juneteenth holiday. And then we are looking at adding a budget workshop on Tuesday, June 20th. More information will be sent out regarding time and location, but I believe we have a planning commission meeting on the same night. So it will likely be in the library or community center if we keep it on that same night.
We're flexible. Nothing else? No other city staff reports? Moving on to city council items, and I think I've picked on everyone equally except you, so we'll start right here, Mr. McMahon. None?
Yeah.
I wanted to give some accolades to Megan Gilliland for her efforts in Evenings on Oak. The event started last Thursday, and we probably had 500 to 800 people come through for that. We had 3 food trucks, a lot of vendors, there was a band. There was so much activity going down on Oak Street. It was really nice to see the community coming together for not only that event, but also the interest that that has generated for also the farmers market and other downtown businesses. I think it's a win for a thriving downtown for Bonner Springs. So just wanted to thank everyone who was involved in that, but particularly Megan for all of her hard work. And then also just reiterate that the Jerry Lee Jarrett Life Center grand opening will be June 24th, 1 to 3. If you didn't pick up an invitation, for those of you who are here, pick one up and definitely go out and support this amazing organization that's supporting our community.
Thank you. Sir? Very fine. Ma'am?
That thing went beautifully on Oak Street, and then right to the city band, and, you know, it was wonderfully organized. It was. Oh, and Danny Gurley will be back on June 24th to the farmer's market to do face painting.
I have my own personal PR department sitting next to me. And I have nothing else.
Sure.
My daughters will be present for face painting.
I just want to thank Public Works staff. A couple months ago, I reached out to Sean, who then reached out to Public Works about, I'd had a couple of residents who lived down along 2nd Street by Old Mill, and the way the traffic was flowing through there, people just assumed that was a big, long driveway for Old Mill, and reached out to staff. They said they'd put it on the list of things to accomplish when paint season came, and I have heard from a couple residents who have been overjoyed that it is now striped, and you can definitely see how the street at 2nd Street turns, and so people hopefully now will not just use that as a driveway into Old Mill without checking for oncoming traffic. So thanks, staff, for that.
Nothing else here.
Very good. Well, that moves us on into the mayor's report, and I'd like to start off first by giving some accolades. Unfortunately, there was an incident at the first band concert of the season on Evenings on Oak, and one of the city band board members tripped and fell and sustained a mild head injury, cut on his head, and perhaps a broken nose, and maybe even some broken ribs. And I heard from his wife on one of their trips to the hospital. They were transported by the Bonner Springs Ambulance Department, and she could not say enough good about the care he received from the compassionate individuals that are operating our ambulance. And she has followed from afar the trials and tribulations we've gone through, moving from a all-volunteer to a part paid and part volunteer staff to now moving to a paid department, and was very thankful for the level of professionalism and care that her husband received. So thank you. Please pass that along. I wanted it duly noted, and she was quite impressed. It does sound like he's doing a little bit better, but is having other complications as his recovery progresses, and so we wish nothing but the best for Don Wheeler. Also, that probably wasn't in any way connected, but painting different roads and streets through Bonner Springs is very valuable. And there was another trip and fall on 3rd Street about a month ago or so, resulting in a broken leg. And I think it was actually a lady sent me, Carrie Mueller, sent me pictures of the curb, and it isn't well marked, and it has some deviations, elevation deviations, and it's on 3rd Street near one of the banks. So little yellow paint would go a long way, or that's all she was asking about. But those are situations that the city council, the city certainly needs to be brought to their attention. I know there's, as we become a more and more walkable community, it's nice to know where there are areas that are have some difficulties, and we'll do our very best. I know the city already does to correct any problems, repair, and improve them wherever they can. So if you need more help with that, I'll let you know. Yeah, I was very, very happy with the Evenings on Oak. The second Thursday of each month through October, I believe they're planning that. And they'll have different entertainment, as well as food trucks and vendors, as well as the farmers market individuals. So please support that if you can at all. And it winds up with a great city band concert. If you have ever played an instrument, yeah, that's a good way to put it. If you've ever played an instrument, you're welcome to come and participate. If you've ever heard an instrument before, you're welcome to come and listen. The two in my world don't really mix, so I have not. I have played an instrument before, but unfortunately, that's not really an option for me anymore. The June city offices will be closed on June 19th for the Juneteenth holiday. Please make plans accordingly if you need any city services. Will that impact trash pickup next week?
I'm not sure. We will check and see if we can find out.
If so, it'll be on our website. I know the last holiday I had to go all the way to the Waste Management website to get my own little question answered. So
we don't put it on our website anymore because it was.
Maybe we could this time if it's going to impact.
Special request.
Yeah, very good. Yes, please. I did.
If you go to their website, you can also sign up for email alerts. I get them via emails. That lets me know if the day is going to be bypassed.
Very good. All right. Other than that, I have nothing new for the city tonight, unless anyone has any questions for me. Seeing none, we are adjourned.